Well, I believe it was in the late 90s, maybe the early 2000s, where we did a study that really looked at what were the causes of infant mortality here in Allen County. And surprisingly, it was a number of women who just did not recognize the signs and symptoms of preterm labor. The most prominent causes of death for our children, our babies, are congenital defects. We also have problems with unsafe sleeping and SIDS, and then preterm labor and preterm delivery is really an important issue for our young babies here in Allen County. Routinely, less than probably 50% of women on average actually get prenatal care in the first trimester. And that's such a disappointing statistic, especially with all the effort that's been made to make sure women have access to health insurance through presumptive eligibility for Medicaid. I just don't think women realize, I think they think because it's natural to have a baby that there isn't a learning curve associated with it. For some women who don't have a lot in the way of social support or who do have complex medical issues that may make their pregnancy a bit more complicated, to have that type of education and case management that Healthier Moms and Babies provides is really critical. That empowers women to really understand their own bodies, and if there's a need to be concerned, it helps them understand to intervene early, ask questions, ask for help earlier rather than later, which all improves our statistics on infant mortality.
A typical home visit, the first thing I do is assess how the patient is doing physically and emotionally. Have they had any big life crisis since our last visit? Then we want to move on. If there's any problems with hunger, homelessness, or harm, we're going to take care of those first. And as long as we're doing okay in those areas, we can move on to prenatal and infant care education.
On a home visit, it has to be tweaked to the client. A lot of times, a teenager, you have a very short window where you can approach, so you start out immediately addressing preterm labor signs, danger signs, when to call the doctor, how's your doctor visit going, because usually, and this is not always, but most teenagers are not chatty. They would rather look at their phone than talk with you.
Another aspect of Healthier Moms and Babies is making sure that we refer the client out to other social service agencies within the community. If someone is having difficulties with meeting their food needs, we'll make sure that they're referred to WIC and SNAP and local food banks. If someone's having problems with domestic abuse, we can refer them out to the YWCA, mental health problems to Park Center, other agencies in the area. A Burmese baby on my caseload was having problems with aspiration pneumonia and had been admitted to the hospital for this condition. On a home visit one day when I arrived, the mother was feeding the baby rice cereal. The baby was old enough to be being fed rice cereal, but the problem was the mom had the baby lying on her lap with the baby's head toward her abdomen, and she was basically shoveling the rice cereal into the baby's mouth while the baby was laying upside down. I was able to explain to the mother that anatomically, this sets the baby up for aspiration pneumonia, and the mother was able to change the way that she feeds the baby. Then I was able to share this information with the pediatric group, who was also seeing other cases of aspiration pneumonia within the Burmese community, and we may have found a problem that causes this.
A couple of months ago, I had a mom that was due in about 4 weeks. And she rang me up and said, "Deb, well, I've had contractions since Thursday." I said, "Did you have them when you were at the doctor's office?" "No, it was after I was at the doctor's office." "Have you timed them?" "Well, last night I timed them. They were 8 to 10 minutes, but not consistent." "You're 36 weeks. What else is going on?" "Well, there's some bleeding this morning too." I said, "I really think you need to give your doctor a call." And then I checked in 30 minutes later, and she said, "Well, I've called the doctor and said, no urgency, but come in and have myself checked today." And I didn't hear from her. So the next day, it's like, I just couldn't let it go. I called her back and said, "Well, how are things?" "Well, I went to work this morning. Everything's fine, but now it's getting kind of hard. Like, the contraction is such that it's a little bit hard to do something." And I said, "Have you timed them recently?" "No." I said, "Hang up, time them, and let me know." And she called me back. She goes, "Well, they're about 5 to 6 minutes apart. You need to hang up. You need to go to the hospital now. So then about 30 minutes later, she called me. She said, oh, they're going to keep me. I'm dilated to 6 centimeters. Well, 10 is when baby comes. That baby was born that night, but a healthy baby. The one thing she said to me, which really stuck, was, you know, Deb, it was nice to have somebody that wasn't Google that could tell me, yeah, this is the time to move.